The clinical psychology program at St. Louis University was recently awarded an $800,000 grant over 3 years. The grant aims to prepare and increase workforce capacity for expanding access to opioid use disorder prevention and treatment services.
This grant is a federally funded training grant, and the aim of the grant is to train the next generation of psychologists in working with a significant public health problem, which is the opioid crisis. So what's really unique about this grant is that there is a huge investment in training, and it is an opportunity both for students to get specialized training both in the classroom as they learn more about what kind of techniques and what kind of strategies work with this population, but also more importantly, they're getting more training actually in the field, working with our community partners, family care health centers, and Chestnut Health Systems.
Chestnut's very excited to partner with St. Louis University on this new grant. It's going to help us provide some good counseling services using some doctoral students to help provide treatment to those in our rural communities that have been really suffered by the opioid epidemic.
I think one of the really cool things about this grant is as part of what is required for the grant is we're offering telehealth services. So with our community partner Chestnut Health Systems, our students will be trained in the provision of telehealth services, and that is a new innovation within our field that's come in the last 10 to 15 years. But it really is about reaching out to rural communities where there's not many providers out there and able to provide those services.
So a lot of our rural communities don't have resources, or the resources are very limited. So we'll be leveraging a lot of our abilities to provide telehealth to reach these individuals through local hospitals, local public health departments, and organizations like that.
I think that's one of the cool things about this grant is we're covering the full swath of what's going on within the opioid epidemic. There's a rural component that is very different of what's going on in rural America in terms of the opioid epidemic versus the inner city. And so Chestnut is helping us get exposure to the rural component of what's going on with the opioid epidemic. And with our other community partner, family care health systems, that's in St. Louis, working with the underserved there, and we really get to see some differences there.
We are really excited about both what the students will bring to us in terms of patient care, but also in terms of contributing to the development of a primary care workforce that can work in an integrated care setting with underserved patients who bring a really complex, diverse set of issues to primary care. And so psychologists see everything primary care providers see in this setting. We are really excited to work with SLU and really value the type of training that the students get there. So we think they bring a lot to our patients.